Psoriatic Arthritis by Jessica Gaber for my Structures of the Human Body class. Definition: psoriatic is a form of arthritic joint disease associated with the chronic skin scaling and fingernail changes seen in psoriasis. It also deteriorates and infects the joints. It can infect any part of the body, as you can see in the picture. Statistics: psoriasis is the most prevalent autoimmune disease in the U.S. It affects 7.5 million Americans, and 2.2% of them have psoriasis. 125 million people worldwide have psoriasis, and 10 to 30% have psoriatic arthritis. 60% report that psoriatic arthritis and psoriasis is a large problem in their everyday life. Patients with moderate or severe experience greater negative impact on quality of life. There's greater impact on women and younger patients. Psoriasis affects people from the ages 15 to 25, but it can be any age, really. And psoriatic arthritis is 30 to 40, but again, it can be any age. There's different types of psoriatic arthritis. There's asymmetric, symmetric, distal interphalangeal joint pendiment, spondylitis, and arthritis mutation. Asymmetric is one side of the joint is infected, so the left knee, the right finger. Symmetric is both sides, so the left knee, the right knee. Distal is the infected of your toes and fingers more. Your nails can become pitted, clubbing, color discoloration. Most doctors refer to it as osteoporosis on your fingers. It's the very tip by the nails. Spondylitis is the infected part of the spine. And the mutation is your joints basically getting stuck and shaped in different forms and ways and stuff like that. That's a picture of your joints mutation, but it's also of how the nails can end up looking. There is no cause of psoriatic arthritis. These are just theories and what scientists think. The immune system begins to attack healthy cells and tissues. Inflammation in your joints, as well as overproductive skin cells. Family history, so it's in your genes. Or some physical trauma like a viral bacterial infection can trigger it. Symptoms: you have swollen fingers and toes, known as called sausage fingers. You can have foot pain, lower back pain. Your joint will feel very warm, like you've been sitting out in the sun for hours. You'll have inflammation, and it can rip the skin open, even. And psoriasis on your skin or scalp. This person in the picture has psoriasis on her skin. It affects any part of the body. It's an autoimmune disease, so pretty much you can have high blood pressure, heart attacks, hypertension, diabetes, obesity. Affects your lungs, your kidneys, your heart, your eyes, your joints, and your skin. There is no cure to psoriatic arthritis, but there are treatments. You can take over-the-counter medications like aspirin, ibuprofen, Tylenol. You can take corticosteroids for the skin, so for your psoriasis. Prednisone to help with the inflammation and pain. And if none of those work, and it's really bad, you can take medications that you have to get from the doctor, prescribed, methotrexate, Humira, minoxidil, those type of things, and in rare cases, surgery. The short term and long term of having psoriatic arthritis, there's no cure, so your joints will get worse. The mutations will happen. The medications will just help slow the process down, but the process will happen. So you'll have the nail pitting and clubbing and discoloration and stuff. You'll have problems with your spine and lower back. You might have to take some other different kinds of medications, whether it be shot-wise, IV-wise, or pills. And you'll feel very fatigued and icky. These are some reference on where I got my information. I struggle with psoriatic arthritis myself, so if you have any questions or want to know some more, just ask. Okay, thank you.